order that you do it in doesn't matter really. In from surgical in a surgical terms, the so I would go on what areas affect you most. Usually after weight loss, it's the tummy. The tummy, the sort of value for money areas are tummy and breast. And so weight loss, it's usually a breast lift to tighten the skin of the breast and a tummy tuck to remove the skin of the tummy. And sometimes if the breasts need to be bigger, then it's a breast augmentation. So some kind of combination of things. So it's usually breast and tummy, which you can do at the same time. Or, oh, here we go. The next part of the question: how many bits would you do in one go? So usually the tummy is the main problem, or the breast. Those are the sort of main areas. So I would just address the main areas first. Also the tummy and the breast are good because you hide the scars. The tummy tuck scar is hidden in your underwear. The breast scar is hidden in your bra. The other sorts of areas that people don't like when they've lost weight are things like their thighs and their arms. And those operations create more scarring, or at least not more scarring, more visible scarring. The arm gets a scar going down there. The leg often needs a big scar. If you lost a lot of weight, big scar down the medial part of your leg. So it's a bit more visible. Those scars are a bit more visible, and so less popular, I would say. So not, the main popular operations are tummy and breast. And but I would say it depends on the person. I mean, if arms really bother you, there's no point in having your tummy back done, because I've said so. Have whatever you want done first. So what order would you work in? So or which and how many procedures can you do in one go? So there's limitation surgically, and there's limitation from you as well. So from your point of view, it's a big op having more procedures in one go, but I can understand how people want it done because they just want to have one recovery and just get it over with. It's quite common to have a tummy and a breast procedure in one go. Depends on what you need to your tummy. So there's different levels of tummy tuck: mini tummy tuck, full tummy tuck, and then circumferential tummy tucks, sort of extended tummy tucks, which go all the way back, and they get increasingly bigger operations. So you can still have that with the breasts. One thing you've got to think about is positioning on the table. So like you say, how many operations can you have in one dose? Sometimes people don't like rolls of fat on their back. But if you're having sort of a tummy operation and a breast operation, and you don't want rolls on and you want the rolls on your back addressed, you have to think about positioning. So if you can access all the areas in one position. So if you're lying on your back, you can access the breast and the tummy relatively easily, then it makes the surgery a lot easier. If you have to rotate the patient, if you have to turn you on your front to operate on your back, that adds a significant extra level of complexity. And so I would probably say, look, you're better off having the front stuff done and then the back stuff done later, unless of course it's all in one circumferential or tummy tuck sort of thing. So that would limit the amount of procedures, and also the length of anesthetic. So it is common to combine procedures. You can combine a breast lift with an arm lift. You can combine a tummy tuck with a thigh lift, but I think it would be a little bit unsafe to do a sort of arm lift and a breast lift and a tummy tuck and a thigh lift sort of all in one go. So you'd probably want to stick with certain areas just because of length of time. These operations take a few hours each. So I say, 2-3 hours for each operation. So 4 to 6 hours for a tummy and a breast is sort of quite a long operation. But then if you want to do a tummy and a breast and an arm, I think that would be too much. So I would probably limit it to sort of two things. At the same time, you can do some liposuction to some areas, but I would limit it to sort of two main areas. So tummy, breast, arms, thighs, I guess, are the main areas that need addressing. And I would do sort of two is what I would recommend. Oh, here we go. Jade's in.